Isabel. I'm gonna be your nurse today. I understand you're here for your 28-week appointment.
Hi, yeah, they told me I'd be getting a test because I'm O negative.
Oh, okay, yeah. So we're gonna be doing a Coombs test. I'll make sure we go over everything before we get started and we answer any questions that you have.
Okay, great.
Okay, so I'm gonna give you this handout so that we can go over the Coombs test together. Is there any questions that you have before we get started?
Yeah, I'm just a little unsure of why I need this test and what a positive result means.
Okay, yeah. So first we want to perform the Coombs test to see if you have developed any antibodies to your fetus's red blood cells. A positive result would indicate that you have developed antibodies to your fetus's red blood cells. If a mother with Rh negative blood is pregnant with a baby who is Rh positive, then sensitization occurs when the fetus's blood mixes with your blood during pregnancy or delivery.
Oh, okay. Thank you.
Okay, so if the mixing of the negative and positive blood does occur, that would cause the mother's immune system to make antibodies against her baby's red blood cells in any future pregnancies. The antibody response can destroy the baby's red blood cells before or after it's born.
Oh, okay, that makes sense. So how do we do this test?
So a Coombs test is an antiglobulin blood test that's performed at 28 weeks of pregnancy, which is why you are here today. And a positive result would determine if there are antibodies to the Rh factor in your blood, or if you end up with a negative result, then that indicates you have not developed any antibodies against your baby's blood.
Okay. So if I am Coombs positive, is there any kind of treatment?
Actually, yes. So we would use a shot called Rhogam. We give it to women who have Rh negative blood when they hit 28 weeks of pregnancy. And then if you have a delivery of an Rh positive baby, you would get it again after 72 hours, or within 72 hours.
Oh, okay. And what does Rhogam do?
So the Rhogam would stop your body from making antibodies that could affect any future pregnancies. And with each pregnancy and delivery of an Rh positive baby, you would need to get the shot again.
Okay, great. That's good to know. Thank you for giving me all this information.
Yeah, of course. Do you have any more questions?
Yeah, actually I have 3 questions I usually like to ask my healthcare providers just to make sure I know what's going on.
Okay, great. So I want to ensure you definitely have a clear understanding of any medical information I have communicated with you today.
Okay, so first my main question is, what are my main concerns?
So we actually don't know yet if you are Coombs positive or negative. So once we do your blood test and get your results, we can discuss the use of Rhogam or not. But the main concern is starting with the blood test and seeing whether you're positive or negative.
Okay, so is there anything that I need to do?
No, for now all you need to do is just get the blood test and then we'll go from there.
Okay, great. My last question is, why is it important for me to do this?
So once again, we just want to make sure that we can perform the test to see if you have developed any antibodies to your baby's blood.
Okay, so just to be clear, if I have a positive result, I do have antibodies, and if it's negative, I don't.
Correct. Is there anything else I can help you with?
No, I think you answered everything. Thank you for explaining it to me.
Yeah, of course. I'm just gonna leave that paper with you, and then if you have any other questions, feel free to ask.
Great, thank you.
All right, I will be back soon.